From the Lean Enterprise Institute in Boston, this is the WLEI podcast, where we share stories of people making the world better through lean thinking and practice. For more information about LEI, including how we can help you apply lean thinking, please visit lean.org.
Welcome to the WLEI podcast. I'm your host, Matt Savis, and today I'm lucky to be joined by two doctors. We have Dr. Jackie Gerhart and Dr. Chris Longhurst. Dr. Gerhart is a family physician and VP of Clinical Informatics at Epic Systems, and Chris is the Chief Medical Officer and Chief Digital Officer at UC San Diego Health. And we talk about new technology, specifically AI, and its influence on healthcare, how it's changing healthcare. We talk about how health systems are using AI and machine learning to improve outcomes for conditions such as sepsis. We talk about how generative AI has the potential to reduce clinician cognitive burden and reconnect doctors with their patients. And we talk about training the next generation of clinicians who'll have access to this technology. This conversation was recorded at LEI's Lean Summit this past March, and the audio quality isn't the best, but I think you'll still enjoy the conversation nonetheless. In fact, if you're unconvinced about the influence of AI, I think Dr. Gerhart and Dr. Longhurst will convince you it is for real. With that, let's get started.
Dr. Longhurst, Dr. Gerhart, thank you here for joining me on the WLEI podcast. Really pleased to have you. We always start these things off with just some brief introductions that give our audience a sense of who you are. I'll start with Dr. Gerhart.
Great. Thanks so much for having me. My name is Jackie, and I'm a family medicine physician by background. I live in Verona, Wisconsin, and work at Epic, which is a healthcare software company that was started by Judy Faulkner, our CEO, in one and a half people in the basement, and has grown to be about 14,000 folks today. And my goal in healthcare is to really try to streamline processes to make sure that patients get the best care that they can.
Amazing. And Dr. Longhurst?
It's great to be here today. Thanks, Matt. I serve as the Chief Medical Officer and Chief Digital Officer for UC San Diego Health. As I like to say, on the Chief Medical Officer side, I see all the problems in the health system. But because I also serve as Chief Digital Officer, I get to try innovative solutions to solve old and long-standing problems. And so it was really a terrific discussion today, and looking forward to the podcast.
Yeah, so you were just on a panel here in Carlsbad. We're at the Lean Summit, and you joined John Toussaint and a fellow physician, I think, on the panel. And you were talking about the problems facing healthcare and how a combination of lean and emerging digital technologies can help solve these challenges. But let's start there. What do you see as the principal problems facing the healthcare industry? Maybe Dr. Gerhart.
Sure. So I attended the conference yesterday as well, and a couple of the other speakers mentioned two big ones. One is staffing shortages, and another one is bottom line. And we didn't just specifically discuss those on our panel, but I think that lends credibility to what we did, which is how do we solve things, for example, by using AI. And so healthcare really struggles right now in being able to make it seamless between the consumer and the healthcare organization, but it's also bigger than that. It's not just the patient that is struggling, the healthcare organizations are struggling, and we as a country are really struggling to get good healthcare out quickly. So working on that is key.
From your perspective, Dr. Longhurst, what would you see as the principal challenges? Anything you would add to what Dr. Gerhart has shared?
Yeah, I think Jackie's doing a great job of helping understand the context at the national level. And for us locally, particularly as a partner of Epic Systems and using their software, I think there's a lot of need to understand not just how these algorithms work and are performing, but how we're redesigning workflow and processes to ensure that the predictions coming from the algorithms impact care in a meaningful way. And ultimately, that's what we owe our patients and families.
So you have this dual role as the Chief Medical Officer and Chief Digital Officer. What have you seen, or what have you already been doing in applying these emerging technologies to do just what you described there?
Sure. A great example is sepsis care. So this is a challenge for every healthcare system. And sepsis is a difficult to identify bloodstream infection that can affect millions of Americans on an annual basis. And a third of a million adults in the US die from sepsis every year. We know that there's variability in when sepsis is identified. And we also know work has been going on for at least a decade on using machine learning and AI algorithms to help predict when sepsis is going to occur. However, until a couple of months ago, there had really only been one research study showing an impact of an AI algorithm on sepsis mortality. And so we were really thrilled at UC San Diego Health when some hard work culminated in an outcome study published in Nature just a couple of months ago, showing the second ever impact on mortality. So patients in our emergency department at UC San Diego Health are constantly being monitored by this algorithm for signs of sepsis. And alerts from this algorithm not only are shared with the care team on the front lines, but also with our code team or centralized response team. And we found that this was associated with a 20% decrease in sepsis mortality in our emergency department. So the lessons learned from this are really profound, which is it's not just the algorithm. The algorithm is necessary, but not sufficient. I think it's 10 or 20% of the outcomes that we're achieving. And those meaningful outcomes require the hard work of the process redesign, the lean-based thinking, the multidisciplinary teams, and even Kaizen events when necessary. Ultimately, that's what led to the outcomes that we found. We could not have done it without the algorithm, but the algorithm wasn't the solution in and of itself. And so I think as a country that we really need to be focused on how these AI algorithms can actually change care outcomes that matter, as opposed to the shiny new object, which is the technology. In fact, I'll just finish by saying that a recent analysis of a lot of these sepsis algorithms suggested that in many cases, they're using features that silently encode clinical suspicion, meaning that the doctor may not have made the diagnosis, but they're thinking about sepsis, which is why they ordered certain labs. And so when you're creating algorithms that are alerting physicians based off of some of those features, it's not early enough in the care process to make a difference. So I really worry about this trend towards FDA approval based off of algorithm vigilance when we know that many of these algorithms aren't going to lead to improvements in care.
So, like you said, AI right now is this shiny new object, and companies seem to be trying to figure out how to use it versus starting back from the problem to solve. If you were advising an organization, what would you say to them about, how do you realize the promise of this technology?
Yeah, it all comes back to the patient. What matters is the patient, did they get better? Did they actually improve from their healthcare experience in which AI was used? I thought Chris mentioned it beautifully that assurance labs are maybe part of the process, but they're not sufficient enough to be able to determine whether an outcome is really, truly helping a patient. It's very hyper-local. It's something that needs to be evaluated with a specific patient population. And the entire workflow really matters. How I'm using it as a physician really matters, not just how it is put up in sort of a test tube or in a box in a lab. And I think as we go forward, we will really see that healthcare organizations are going to use this differently, just like patients are already using AI differently. And we want to make sure that it's done in a way that is not biased and is safe, but also allows for a lot of innovation. These are tools that are going to save our clinicians time, save healthcare organizations money, and really advance medicine. And to make too much regulation on those would be the wrong way to go. It would actually take away from the patient care that we could provide.
Well, something you said during the panel discussion, Dr. Gerhart, it resonated with me. My sister, she's an RN. She works in pediatric oncology. My mother is a retired nurse. And you talked about how AI may be able to help clinicians reduce the cognitive burden. We talked about things like entering medical records. My sister often complains about how much time she needs to spend away from her patients who are really sick kids. That's where she wants to be. That's where the kids need her to be. What sort of, can you share more about that? What are some applications you're seeing where the promise of that is either being realized or you see what's possible?
Yeah. So we already discussed something like sepsis, but there's so much more to the world of AI. So generative AI is kind of the new kid on the block. And we've been using that for clinical efficiency and clinician happiness, for organizational efficiency, and then for advancing medicine. So to your point, writing notes is one big burden that clinicians often have. They really would like to spend more time with their patient. That's why we went to medical school. That's why we went into the career that we did. And being able to look in the patient's eye and actually spend time with them, understanding their problem and hearing their words is extraordinarily important. One of the technologies, which is ambient voice, is the ability for a patient and a physician to sit in a room together, have a phone between them, so no computer, no nothing blocking my view, and I'm able to have that recorded in the patient's own words, and then the AI technology reformats that into a note that is clinically acceptable and also able to be billed from. And so it decreases the amount of time that I actually have to spend writing. In fact, in theory, I could write nothing, or I could go back and edit it afterwards, but there still is always a human in the loop. So I review the note, I make sure it captured everything that I'm thinking and that the patient is thinking. And then in the future, we're looking forward to not just the note being written, but other things coming from what I say into the system. So instead of me examining the patient's thyroid on the exam table and then walking back to the computer and typing in TSH, in theory, I could be having a conversation with my patient. The ambient technology could pick up her symptoms, like maybe she has a goiter, but then I could also say, I'd like to order a TSH and a thyroid ultrasound. And I wouldn't have to actually put it in. It would go into those orders. And even beyond that, there's some ambient companies that are looking at updating patient instructions. So instead of it being a former sort of like a boilerplate on what hypothyroidism is, it could tailor the instructions specifically to the patient. So it could be in Spanish, it could write it at a 5th grade reading level, it could make sure that any follow-up actions that I said were necessary are written into the instructions so it's bespoke to the patient rather than just talking about the disease in general. So those are some examples of how we're really looking for it.
I'm gonna get that clip over to my sister.
Yeah.
When we're talking that is a So, healthcare, doctors are some of the most well-trained people on earth, and the value that they provide is, principally from their knowledge, their extensive training. There's a lot of talk about how AI, I don't know, it could present a kind of threat to people who are in these either medical or white-collar jobs, people like me. I could evaporate in the next year or two, who knows? I don't know. But, Dr. Longhurst, as you're responsible for, these two sides of the healthcare organization, what's your approach to getting doctors to try out these new technologies, convince them that they're worth using?
Yeah, that's a terrific question. So first of all, I've been in this field for 25 years now, and we spent 10 or 15 years implementing electronic health records for lots of good reasons. It created a digital infrastructure for quality and patient safety improvement. It created the ability to have guardrails for medication orders and decision support. But fundamentally, it also introduced new problems, like Jackie was saying. The classic, pediatric article with the picture of doctor's back to a patient, while he or she's typing at the keyboard is kind of the essence of that problem. And so I 100% agree with Jackie that we see an opportunity for AI to actually unwind some of what we have done to our clinicians. And yet at the same time, preserve the benefits and even amplify those in many cases, because now we can use tools like generative AI to provide decision support, not just on discrete data, but also on text data and images. And so I'm bullish on this overall. As I said on the panel, though, I think that we overestimate the benefit of AI in the next 2 or 3 years and underestimate the potential benefit in the next 10. I think AI is going to be as impactful as penicillin long term. And to paraphrase the Navy SEALs, in healthcare AI, slow is smooth and smooth is fast. We have to be very thoughtful and methodical about how we're measuring these outcomes, because ultimately, if we move too fast in healthcare and break things, we're going to hurt patients. And that's the last thing any of us want. So we will get there. And I'm bullish about where AI is going to take us over the next decade. but we have to measure things over the next several years to make sure that we're doing it in the right way.
So let's look ahead at 10 years down the road. If you have a college student taking their organic chemistry class right now, preparing for their pre-med recs and entering medical school, what do you think should be on their mind or their instructors' minds about how to prepare them for the future of healthcare when they finally get to work with patients?
Yeah. I'm actually mildly jealous. I would love to have trained during the time of AI, and being able to practice medicine in the time of AI is truly a privilege. I agree with Chris that it's going to be bigger than penicillin. When I think about learners that are coming into medicine, so much of our time is spent gathering information and comparing it to already written literature. And that is what I would consider table stakes in medicine. That's just something that was previously a necessity in your training. I can see people working more at the top of their license even before they get their license. So learning at the top of their capacity. So instead of maybe gathering vital signs before I go to round on a patient, all of that information using AI can be summarized for me. So I know what happened in the last 24 hours, so that I know how the x-ray 3 days ago changed compared to the x-ray today, without having to go into individual records to look at that myself. So that'll save me time, but more importantly, the insights that I can generate will be higher level thinking than the gathering and foraging that I previously would have done. And so as clinicians are becoming, new clinicians, they can focus on things like, how do I interact with a patient? How do I deliver bad news? How do I truly do the doctoring piece? And how do I help the AI give the information piece and to build up my ability as a human? It's like the co-pilot. We talked about co-pilot during the lab too, or during this talk, I should say. That's really the crux of it, is I would rather have something next to me helping me do my job well. It's not something that I see as being a replacement for a physician. It's something I see as me being able to be more human in my medicine.
It's fascinating. We were talking with a CTO of a software company, and he was talking about the application of AI for coding. And he said there was an unintended consequence, something, I hadn't imagined, but it makes sense, where he saw junior engineers were using the technology, presumably with permission inside the organization, to write code. But something that was unexpected was the machine wrote poor code. It worked, but it was just poorly written. But because it worked, the junior engineer didn't realize that it wasn't, it was clumsy code. But he was too junior to recognize that. And so do you see risk in reliance too much on the machine in especially young people's development?
That's a great question too. And I agree with Jackie about the opportunity for AI to really restore humanism in medicine. And so I am also envious of our younger trainees, because they're emerging into medical practice at such an exciting time, where AI augmented clinical practice is going to let everybody operate at the top of their license, make better, faster diagnoses, be smarter, have the world's knowledge and information at their fingertips. And at the same time, we have decades of literature around what's called automation bias. And this has been known long before AI. In fact, pilots and the airline industry was one of the first to study this in the context of autopilots for airplanes, because the planes could essentially, take off and land themselves, fly the whole way. And yet if they let the planes do that, the pilots lose their skills and become too reliant. There have been real plane accidents based off of over-reliance on the technology. And so in the cockpit, they've taken to a lot of training to mitigate automation bias, including ensuring that pilots are still getting their hours and flying, recognizing times when the autopilot can be wrong, and how to surface that. And so the same is true in healthcare. Just like clinical decision support rules and alerts about medication dosing could unintentionally lead to poor dosing or propagation of automated errors, it's important clinicians understand at the end of the day, they're responsible for the practice of medicine, not the computer. and they need to be thoughtful in what they're implementing. And so I think that's really where we need to focus on training our next generation of clinicians, is on recognizing potential sources of automation bias and when to push back and question those algorithms. And that's a different type of training than we provide today. And it's going to force our medical education system to rethink some of their processes as well.
Yeah, I think there's 3 processes in medical training that will change. The first is we are trained in the scientific process and in the research process. So we're going to have to apply those specific learnings to evaluating the different AI tools and seeing whether or not they are rigorous. Second, we as clinicians need to be very vigilant about what applies to our population and what applies to the patient right in front of us. It's not enough to have an algorithm tested in the lab. It is something that we need to actually see in practice and use on our patients to see if it really is changing the outcomes. So instead of, before I blindly put something in, I need to evaluate it locally. And then finally, it'll be our challenge to make sure that we're seeing transparency. So just like as we learn medical facts as we go along, we also need to learn how to be as transparent as possible with our AI tools so that we know to use them in the right ways. Using data and learning medical data is just one thing, but knowing how to apply it is really the key of being a clinician, is really what we're being trained to do. So having that ability is something I'm hoping schools will do more of.
Well, thank you for the thoughtful conversation on the future. I'm pleased to end it with the machine not taking over, and in fact, humans are still going to be in charge. So that gave me some peace of mind. But Dr. Gerhart, Dr. Longhurst, thanks for joining me on the podcast.
Terrific. Thank you.
I'd like to thank Dr. Gerhart and Dr. Longhurst for joining me here on the podcast. If you're keen to learn more and engage in discussion on how new technologies are transforming the workplace among other huge business challenges we're facing these days, check out LEI's upcoming event, the Future of People at Work Symposium, taking place July 18th and 19th in Detroit. You can find out more at lean.org. Thanks to you all for listening.